Hello everyone, I just wanted to come by and give you a quick video. Social media is so not my thing, but here I am nevertheless. I just wanted to talk to you really quick about how you would know that you need partial hospitalization, because that's a question that is asked quite frequently. How do I know whether or not I need partial hospitalization versus just being strictly an outpatient patient? So you're gonna need partial hospitalization if you have significant impairing symptoms, meaning that you're experiencing depression, but it's debilitating, right? It's keeping you from enjoying life, or you're extremely anxious, or you're feeling unsafe, right? So not just having the symptoms, but having symptoms that are impairing you in some way. Another way that you would know is that you need more structure than can be provided in strictly outpatient, right? Doing one-on-one therapy weekly is not enough for you, right? You need the structure of a 9-to-1 type of environment, meaning, I have therapy for this, I have therapy for that, right? I do process, I do psychoeducation, I'm learning to implement these skills, right? So that can't really be done in an individual one-on-one, once a week type of session. Another way is that another way you know that you are in need of intensive outpatient or partial hospitalization is because you have some sort of safety concerns. You are not necessarily suicidal, but maybe you engage in self-harm, right? Maybe you're not taking as good of care of yourself as you should be. Maybe you have a sense of hopelessness, being emotionally unstable, things along this line, right? You're not an immediate danger to yourself or to others, but you do have some sort of safety concerns that would recommend that higher level of care. Or, speaking of higher levels of care, you're transitioning out of a higher level of care. You're going from an inpatient environment to stepping down to partial hospitalization or intensive outpatient. A lot of people would like to make that transition where they're not just thrown back into life or into the environment from which they came that caused them to go inpatient in the first place. So partial hospitalization is a nice step down, a nice gradual transition from being in an inpatient environment to going back to, your everyday life. And another way that you would know that you could probably go to partial hospitalization or intensive outpatient is if you could benefit from seeing a multidisciplinary team. So here, for example, we have doctor on staff, therapist on staff, nurse on staff. So you would benefit from seeing people in these multiple disciplines, meaning, you're going to get a psychiatric evaluation, you're going to get your medication management, you're going to have therapy with multiple therapists, you're going to get that nursing evaluation, right? So just knowing that you can benefit from seeing different types of providers all in one location. So I hope that answers the question as to how a person would know whether or not they should be in partial hospitalization or intensive outpatient environment. All right, take care. See you soon. Bye.